Hi there. Welcome to this CARSI research webinar. Today we are focusing on a recent research brief titled Outlaw Operators, Prevention Failures and the Resurgence of Black Lung in Central Appalachia. I'm joined by the researcher on this brief, Aysha Bodenhamer. I want to just give you a quick bio on Aysha. She's an assistant professor of sociology at Radford University's College of Humanities and Behavioral Sciences. Her research really examines looks at energy, environment, and human populations, and some of her recent research is focused on extractive industries and contested environmental illnesses, particularly the resurgence of Black Lung. And that was a big focus of this brief, which came out just last week. And you can find it at carsi.unh.edu/publications. Aysha, I'll let you take over now and kick us off. Talk to us a little bit about this project, this research brief, and what really prompted it.
Okay, great. As Nick said, my name is Aysha Bodenhamer. I'm happy to be with you all today. And this is some work that really spiraled out of some other work that I did. I first started out researching mountaintop removal among coal mining communities in West Virginia. And as I was out there in West Virginia interviewing participants, folks started telling me about Black Lung. And like most folks that I've talked to since then, they said, wow, that's still a thing. And so that became my dissertation research project. Since then, I've done a couple different waves of data collection. And it's always just so striking to me that, one, that we thought that this disease was completely eradicated, but it's back and it's surging in Central Appalachia in particular.
Excellent. We have a few attendees now, and before we talk anymore, I just want to say if you folks who are watching, if you have questions for Aysha, you can put them in the Q&A box there online, and my colleague Laurel Lloyd and I will help facilitate those questions. So you talked a little bit about what prompted this research. Could you provide like a quick historical context of Black lung disease and its impact? How long it's been around, what its impact been in the United States and maybe globally?
Sure, absolutely. It really started, the first discovery of Black lung was with some British medical folks in the 1800s. Yet it took until 1969 in the United States for Black lung to be officially recognized as a legitimate disease. Miners knew that it existed. They knew they were getting sick, but there was a lot of pushback from the coal operators who said, no, it's fine. Don't worry about it. It's just a miner's cough. It's no big deal. And so it took a really long time for it to actually become a legitimate disease in the United States. And really, it took government action for that to happen. So there was a mine explosion in West Virginia, the Farmington mine disaster, and that became a political platform for folks to start advocating for health and safety within the mines. So there were about 30,000 miners that went on strike. And this was really the only reason why Black lung became officially recognized in the United States. And like I said, this was, well over 100 years later that it was recognized in the U.S. I think the latest figure I saw was over that time, since the 1900s in the United States, over 200,000 miners have died of black lung, and that includes the folks that where it was an official recognition. So there are a lot of folks who died from it, but their cause of death was classified as something else. So it's something that we have some idea of what's happening and what the impact has been over time, but there's a lot of data loopholes that we haven't really been able to fill yet. As far as internationally, I know that China is probably one of the leading countries in the world as far as black lung cases go, but we don't hear much about what's going on there. And it is a very difficult place to kind of get in there and be able to talk with minors about their disease experiences. But there are some folks that are doing that research. There have also been some efforts to study black lung in Australia, but Australia is not seeing the numbers that we are here in the United States. So at this time, I would say that the leading country is China as far as most cases of black lung, and then the United States is following them.
Excellent. Is this sort of your foray into this research area? Or is this, have you studied it for a little while, and how did you get into kind of this focus area?
Sure. Like I said, I started out kind of as an environmental sociologist, and I've transitioned more into labor issues. And this project in particular is kind of a wedding of a couple different ideas, right? Of that environmental disease, but also what's going on from the labor side as well. I totally fell into this project, right? As I said, it was only because research participants were telling me black lung is a really big problem, yet nobody's talking about it. And so I started to do a little more preliminary research. And sure enough, I found that, wow, this is a huge problem and no one is talking about it. So that's why it became my dissertation project. But at this time, I've probably been researching black lung at least 5 years, with preliminary research really taking place even beyond that. Um, so it's become kind of a pet project of mine, because what I found was that the research that was being done on this disease in particular was from an epidemiological standpoint. But given my experiences with researching coal mining in the Appalachian region, I knew that there were some social dimensions there that these epidemiologists weren't tapping into. And so that's why I wanted to use this sociological lens to start to crack open some of those things that were happening.
Great. Is there anything that you found, especially within this most recent research brief, that was real striking to you? And is anything that you found, that you hadn't discovered before in some of your previous research papers on this topic?
Sure. I'll go ahead and share my screen with you and show you a couple of the key points from the actual brief. So I think what's most striking to me is, and to go beyond the brief and really make it a little more personable, is that the miners that I talk to, it's almost like they are sacrificing themselves, right? They talk about how they don't see any way to prevent black lung. They do this because it is the best paying job they can possibly get, especially in Central Appalachia, uh, where a lot of areas have very depressed economies. And a lot of folks assume that coal miners are just dumb rednecks, but that's certainly not the case. These are some of the most intelligent folks I've ever encountered. But that money that they get is it's lucrative for this area. So just to give you an idea, coal miners can start out making $60,000 to $70,000 with a high school education, and that's nearly unheard of. I have a PhD and I barely make anything like that. So just to put it into perspective, that it is seductive, right? That that pay scale, but also there's also a lot of pride that these miners have. It's a family tradition. It's been going on for generations, and so it's something that it's almost like a military attitude where folks just have that pride and that family tradition, that sense of community or brotherhood, the way they talk about this work. But what's most unfortunate about that is this is a preventable disease, right? We know that it can be prevented. There are laws in place, regulations in place that are designed by the experts to prevent this disease, and yet it's just not happening. And I think that is truly unfortunate that this is something that we could really control much better than we do. But like I said, these guys really see it as we're just sacrificing ourselves for our families so that they can have the best income that they can. And hopefully, if I do die with black lung, they'll get black lung benefits on the backside of that. So the compensation piece is also just extremely problematic. These miners, oftentimes, they die before they're even compensated. They have to fight the coal company to get these meager benefits, which starts out at like 680 some dollars for a single filer. Um, but what's most expensive about these benefits, and this is what I've gathered over the years, is the true problem, or why the coal industry fights, is because of those medical benefits. So black lung is extremely expensive to treat. It is not curable, but you can imagine as your lungs essentially harden. Literally, I've seen pictures where these miners' lungs look like lumps of charcoal that you would put in your grill. Um, you have a lot of problems, right? Throughout your entire body, it just kind of has a snowball effect of the health problems that come from it. So that is what becomes most expensive, and that is why a lot of these coal companies try to fight those benefits. But it's not just the coal companies. Something that I think the brief I didn't really go into was that oftentimes these coal companies pay into an insurance company to handle these black lung claims. So it really becomes a third party of the coal industry, so that the coal industry is able to essentially just wipe their hands clean from it, and rely on these insurance companies to protect their own interests.
Um, this was before I go on um, to ask you about the policy recommendations that came out of this research. I was curious. Um, this research focused on Appalachia in particular. Are these issues these related to coal mining found elsewhere in the U.S.? Is there coal mining elsewhere in the U.S.? Do the miners there deal with the same problems?
That's a great question. Yes, so there are other coal mining regions in the U.S. Wyoming, for example, is the leading producer of coal in the United States. But what's interesting about this is that they are not experiencing these same issues. So I think that's what's truly unique about this, and another reason why um, I wanted to study this issue, because I think it is that social dynamic, that there's a lot going on within the workplace that seems to be very different from the mines out west. Now, granted, I haven't been able to get out west yet and study the mining culture out there, but it's on my to-do list in the future. But I think that's what's really interesting about this, is that this resurgence of black lung is truly isolated to Appalachia at this time within the United States. And that's what I think is really unique about this.
Gotcha. So let's talk about some of the policy recommendations that you have based on this research. Um, are there, what do you think needs to move forward to even just stop the rise in black lung or eliminate it?
Right. Well, again, I think the unfortunate part of this, or maybe fortunate, right, is that the legislation is in place to already prevent it. It's just a matter of enforcing it. From what I've gathered, there seems to be this culture of profit over health and safety. If a mine explodes, it gets very quick attention, right? Oh, this was horrible. This happened. But black lung is almost like a silent killer, right? It takes years for it to develop. And then oftentimes these guys, and I say guys because I've yet to interview a female coal miner. They do exist, but they're pretty rare. Um, but a lot of times these guys are dying in their homes, right? It's not out in the public. People don't see this. So I think that's part of the issue, right? Is it is kind of that silent killer. But you have to have industry buy-in, right? And we're kind of experiencing this culture now in the United States, and this is not just with coal mining, this is everywhere, that regulations are bad. Regulations are job killers. Regulation is anti-business, and we have to find a way to move beyond that because these regulations have been developed to protect human life and health and safety. So I mean, I know that's a big charge, but that's something that we really need to tackle. And we really need to buy into this rhetoric that regulation is for better um, better health and safety within the workplace, right? I think the other thing that is low hanging fruit that may help is the coal companies being briefed with the latest NIOSH findings. So that's the National Institute of Occupational Safety and Health. And so just having those updated numbers, and maybe they're already doing that, but to my knowledge, they're not doing that right now. There's been kind of this resistance to working with regulators, to working with um, these government agencies. So I think having better collaboration between groups would be extremely helpful. Something else that is low hanging fruit that I think would be easy to implement is really improving MSHA, which is Mining Safety and Health Administration, really improving their health and safety training. I know they talk about dust, but from what I hear from miners, it's just kind of brushed off. Oh, don't worry about that. That's an old man's disease. And they kind of move on to the next slide, right? So, really getting down into the weeds of how dangerous dust is, and really even tackling those masculinities in the workplace. You know, really learning about the best protocol for tackling this issue. Something else that I think would be extremely helpful is creating mandatory annual black lung screenings for every miner. So, what I have found thus far is that these programs are voluntary. And so, what happens is if a miner goes and gets tested for black lung and their employer finds out about it, oftentimes they're fired. Now, obviously, it's illegal to, discriminate for things like that, but it may be for a reason other than what they're doing, right? So it could be, oh, well, you were late for a day, so they just get fired. When in reality, they find out, oh, well, you went for a black lung screening and you're a liability. So that is something that I think would reduce the the unfair advantage, right? Or reduce that scrutiny that these minors are facing. Just go ahead and make it mandatory so that you know who's got it, and you can go from there, right?
Great. I know there are some data slides that you wanted to show.
Sure. So I think this figure really just shows you how big of a problem this is in Central Appalachia compared to the rest of the United States. Something else I want to point out looking at this slide is we often throw around what we call the resurgence of Black Lung, but that insinuates that it completely went away. But Black Lung never completely went away. It may have decreased to about 3% there at one time, as you can see by the yellow line there around the late 90s and early 2000s. And then in 2000 is when that uptick started again. So again, you can see this cluster of Central Appalachia. We've got Kentucky, Virginia, and West Virginia compared to the entire United States. So that just gives you an idea of the gravity of this situation, and how it is isolated to Central Appalachia at this time. I think this one's also interesting just to show you how testing used to be much higher, right? 1970 was when they first started to disperse Black lung payments, right? Black lung compensation. And my understanding is that it was much easier to get compensation at this time. So everybody wanted to be tested because it was much easier to get benefits. And as time has gone by, this legislation has become more and more conservative. Um, so less folks are actually getting tested. One, because of the employment issues that I told you about, but also a lot of minors think, what difference does it make, right? Why go through the testing process if I'm never going to be compensated? Or if I can't get a better job anyway, why even go through the trouble? So I do think there's a lot of social reasons why these minors are also not getting tested, right? It's being disincentivized instead of incentivized, right? But I think this just shows you kind of that loop, or that missing data loop here, where in West Virginia in particular, you've got a large percentage of minors that have Black lung, but you have very small numbers of folks that are actually being tested. So the question remains, how big is this problem, right? That we don't fully understand yet.
Great. I think your next slide provides some contact information for you to if people have questions or follow up. And I imagine, do you have upcoming research that people should look for on your website around this issue or around other issues?
I think I did recently publish an article in the Rural Sociology Journal with my co-author Tom Schreiber. So we've been working on this issue for many years, and there's still a lot of work to be done. I've kind of shifted gears lately. This was the first policy piece that I worked on, but it is something that I'm interested in doing more. And I'm also working on some technical reports for the Black lung clinics that I worked with back in the fall. So I'm kind of switching gears from the academic scholar world into the applied world for a little while, because I think that's where my attention needs to be at this time. But yes, this is a not just a project, but I think it's something that is it's underrepresented, and I'm excited to be part of this and to help share these miners' voice.
Excellent. If anyone has any questions for Aysha, you can put the questions in the chat box or the Q&A. Laurel, I don't know if you had any questions come in.
Checking the QA, and let me just check the. Yeah, I think we are. I think we're in good shape.
All right. Aysha, is there any last final thoughts you want about this vein of research or this particular brief that you did for CARSI, which people can find at carsi.unh.edu/publications?
I think this project points to a couple different issues that tend to plague rural or vulnerable populations. We often don't hear those voices, right? And so, and you also don't know, you can't find what you're not looking for, right? So, this has been a project that I literally stumbled upon, but has been extremely heartfelt in trying, just hearing these stories and how awful this experience really is when it's totally preventable. So I think it is a great place for us to step up as a nation and say, just having high profit margin isn't enough, but we have to be able to protect our workforce as well, and really, look after these folks. So I think it's not unique and only isolated to coal mining. I think this is a national issue in many different sectors. Um, but yeah, I think it touches on quite a few different areas that we need to kind of wake up and be aware of.
Absolutely. I think that's true for um, a lot of industries like this. I want to thank you all for attending and for watching online. And I said all our research is at carsi.unh.edu/publications. Aysha, I want to thank you for writing this brief for CARSI, for joining us for a webinar.
Thank you.